Welcome. My name is Natasha Sherman, and I am your host. And I've always been interested in alternative healing therapies. And recently I came across Dr. Carlos Bautista. He is the medical director and founder of Immunity Therapy Center, or ITC, in Tijuana, Mexico. I was so impressed with the information on his website that I asked him to be a guest on my show. Dr. Bautista is a board-certified medical doctor. He began his medical career in 1994, working in a hospital that offered alternative medicine and therapies. A turning point in his life occurred when his father was diagnosed with cancer. As Dr. Bautista watched his father suffer the effects of chemotherapy and radiation, he was driven further to study alternative cancer treatments, both for his father and for other cancer patients. He has been working for more than 25 years with alternative medicine to treat cancer, autoimmune diseases, chronic degenerative diseases, and infectious diseases. He has found that alternative cancer therapies have a higher success and survival rate. So, welcome, Dr. Bautista.
Hi, Natasha. Thank you for having me. I appreciate it.
I'm delighted that we can do this. So I'm going to ask you a question. So when your father was diagnosed, how many years ago was this? And were you able to help him, or did you not know enough at that time?
I was in my last year of school, you know, here in Mexico. When you finish your medical education, you have to work for the government, like a social service for 1 year. They send you to a rural, you know, area.
Yes.
So you can work. And that's when, in that period of time, that's when my dad was diagnosed with lung cancer, small cell. So I basically I was making night shifts at one hospital, but just because I needed to work.
Sure.
And that's where they hired me, and it was a very small alternative medicine clinic. I was doing night shift then. So that's when my father was diagnosed with this lung cancer. And
I'm assuming he didn't make it?
No, I was not able to do much because I was in my training phase, you know.
Sure.
I took him to my doctor's friends, and they did the best they could, but we're talking 1998 back then.
Yeah, so a lot of things have changed.
Yeah, it was a situation where high dose chemo and radiation were the only options, like right now, unfortunately. Well, now
I'm going to interrupt you here because I want to talk about that. So first of all, I'm assuming there's no issue with government or laws in Mexico with you practicing alternative medicine. Is that correct?
No, there is a lot of supervision, and there is a lot of, we have to have like research studies going on to be able to perform these
so there's a lot
therapies.
Of oversight.
Yeah, there's a lot of government paperwork that we need to do to be able to do these treatments and permits. It's not like you can do whatever you want. We are very supervised, and probably that's a misconception, that we are very supervised with everything that we do. And we go through a lot of issues, a lot of trying to do these treatments here, and we're reviewed by government boards and stuff like that often.
So then the question is, you know, when people are diagnosed with a, let's say, cancer, it's a terrifying time for them. And we've been culturally acclimatized, even if we have doubts, to buy into the whole chemo, radiation, traditional treatment of cancer. And they're introducing some small alternative kinds of things. So even though people may understand and hear about alternatives, there is the fear factor. So how do you address that?
Yeah, the majority of the patients, unfortunately, that we receive here are late stage, cancer patients, stage 4, I will wish that we were able to get them earlier. They come to these type of treatments where they basically are told at home that there's no other option. That's the majority of the patients that come here. But there are some patients that come as their first option. And it's not that we are against chemo or against radiation. If chemotherapy, normal chemotherapy or radiation cure patients, will be all for it, taking care of the side effects and the problems. But the situation is that they basically, the work percentage or the response percentage is extremely low, in sarcomas is like 20%.
So it's low if they continue with the chemotherapy.
Yeah, well, in certain cancers, like testicular cancer, like some lymphomas, Hodgkin lymphoma, chemotherapy work really well, They have a response rate of over 85%, something like that, and that is good. And that's when we probably are okay with them doing chemo. But the majority of the other type of cancers, whatever you can think of, the response rate with conventional chemotherapy are very low.
So when they come to you, so let's say someone comes to you and you've got a history of successes. Have you actually cured their cancers, or do they just walk away with cancer plus a longer, better lifespan?
Look, we don't promise anything here when they come here. We're very clear about their options or their chances. There are patients already in stage 4 that are very consumed and very late stage that we tell them not to come. Answering your question, yes. In some cases, thank God, the majority of the cases that come here, we were able either to stop the tumor process or the cancer growth, or put them in remission. Okay. There's certain cancers.
That's pretty significant.
Yeah, there's certain cancers that we have a better response. I can think of lymphomas, breast cancers, things like that, where we know by our statistics that we're having a high response rate. But yeah, definitely there's a therapy that we do here where we use low-dose chemo treatments. It's called VPT, where we try to target the cancer area only with this form of therapy, where we have very good response. But the majority of our treatments consist on immunotherapies, okay? And I mean alternative immunotherapy, which is different than conventional immunotherapy that has been researched, but those are mostly medications like Opdivo or Keytruda. That is a conventional immunotherapy. Here we do a different kind where we use specific transfer factors, macrophage activating factors, and other type of treatments where we try to stimulate the immune system.
So I'm going to interrupt you here. I have a question based on that. So it occurs to me that what you're doing with these alternative therapies is the goal is to make the body healthy enough or stimulate the body so that it can heal itself, which is what the body wants to do anyway.
Correct. And we try to put the right environment, like oxygen treatments, trying to create a rich oxygen environment. One of the problems is that the immune system does not recognize cancer cells. So we try to stimulate the part of the immune system in charge of fighting cancer to be able to recognize the cancer cells. So, and we combine with other treatments. We do different intravenous solutions, high dose vitamin C, curcumin, soursop, graviola, sodium bicarbonate, all of these intravenous that are going to destroy cancer cells, but also we try to put the body in with the right environment so it's able to heal itself, like you're saying.
So how important is mental and emotional state to healing?
It is very important. You know, it's already proven that the psychospiritual part, you know, is very important to deal with. We have a program here where we don't go into too deep, but we try to give the support and the counseling needed to address those emotional issues. Almost invariable patients that develop cancer, they had some emotional stress, you know, almost always. So definitely it's an important factor that needs to be addressed if you want to have the cancer successfully treated, and also very important to avoid the cancer from coming back.
So, you know, I'm just going to kind of throw in a couple of things. I interviewed a radiation oncologist, and he also identified himself as a quantum biologist. And we had a conversation, and I laughed at something he said. And he said, you know, with that laughter, you've just released millions of dollars worth of positive chemicals for your body. And someone else I interviewed who has been in addiction recovery for over 30 years and teaches yoga and mindset. And he posited that the body is the best pharmacist or the pharmacy that you can tap into. So I'm assuming that with everything you're doing, it's really, again, guiding the body to heal.
Yes, definitely. But when you have a body that is not working properly, sometimes there are things that you don't want to stimulate, you know. And for example, cancer, it's a chronic inflammatory process. So for example, in the normally our body, the adrenal glands will produce certain substances to reduce natural inflammation. So when you have been using those for a long time, they stop working. So no matter what you do, the adrenal glands will not respond, and they will be fatigued. So that's when you need to address those issues and try to use, for example, other type of natural anti-inflammatories, curcumin and things like that, to try to help the body with the inflammation process. At the same time, support the adrenal function. So hopefully by reducing inflammation, the adrenal system will start working again.
Right.
So, you know, you're right, but it's a very complex, you know, situation.
It can't be simplified.
With these severe problems.
So I'm going to throw in a question. How has COVID affected your practice, and have you been treating COVID patients?
No, we have not treated COVID patients because of the nature of our practice. The majority of them are cancer patients, late stage, and they already treated with many chemos and radiation, and they already immune suppressed. So definitely bringing a COVID patient can put them in very high risk. So no. Affecting our practice, well, like with everybody, you know, everything came down a little bit. The amount of patients coming here, but we've been working a lot, thank God, the last year. You know, patients still need, you know, their care, and they continue being problems. We're taking care of we're functioning with all the COVID protocols, but we do not accept COVID positive patients.
That makes sense. Yes.
Until they are better.
So what is the medical system like in Mexico? Is it supplemented by the government? How do people pay for medical assistance?
No, here we have a social security system. That means that the government, you know, pays. It's very poor, unfortunately, you know, the care. There's a big problem right now with not being medications for cancer in the government hospitals. Nowadays, it's becoming more common, you know, having private insurances, but they're kind of expensive. but the majority of the people, services are really expensive. Don't get me wrong here. Majority of the people end up paying a lot of money if you're not covered by any government social like the IMSS or, their state programs and their federal government hospitals. But the majority, 95% of the population, they have one way or the other access to these hospital programs. The rest of the 5% are private insurances. But don't get me wrong, the service given at these government hospital is very poor. There's no medications most of the time. Yeah, and right now there's a crisis with cancer medications.
They can't get access to them?
They can get access to them, yeah. Very, very unfortunately, kids with cancer, they're not getting the medications that they need, unfortunately.
Wow, that's pretty shocking.
Yeah, it's pretty unfortunate. I don't know the reasons for it. It's a government thing, but that's what I hear in the news.
Yeah. Is there anything else that you don't treat? I mean, what about, again, just what pops into mind is Alzheimer's. Is there any way to treat Alzheimer's differently than we currently are treating it?
Okay, well, yes, there's things that we can use, like oxygen treatments, stem cell therapy. Unfortunately, their response with percentage is low, depends a lot also how far, the patient is with these problems like that. But yeah, we have a different specialist as well here in the hospital, all types, and when we get patients like those, we review the cases with them, and we give the treatments that we, based on our experience, might work in problems like that. Depends a lot on the stage and how the patient is, to see what we can expect, to evaluate what we can expect.
Yeah. And I'm assuming you don't use any traditional medications at all.
No, we do. Unfortunately, in cancer patients, you need to have like painkillers, antibiotics.
Okay.
Because most of them can develop pneumonias or infections. So we do have internal medicine doctors here on staff to take care of the metabolic problems with cancer patients. And sometimes we need to rely with medications at the same time that we are applying, all these other treatments, but we need to resolve an infection, or we need to resolve pain or things like that.
So I read on the website that a typical stay at your facility is around 3 weeks. So when people leave after 3 weeks, do they then change their lifestyle, have to do things differently? Do you educate them on what they have to do? How do they sustain what you started?
Yes, patients where they're leaving, they're given what we call a home program that consists on supplementation, therapies, and immunotherapy that they're supposed to continue at home. Depends on the stage and the condition of the patients. Sometimes 3 weeks is not enough, Natasha. So we tell them to stay a little bit longer. Sometimes we ask them to stay 6 weeks. Obviously, financially, we help them. We try to give discounts or try to accommodate to whatever situation they might be, because sometimes the problems that we face here are very severe, very advanced type of cancers where 3 weeks is not enough time. And patients that cannot stay for whatever reason, when we recommend them to stay, we do the best home programs that we can for them.
Yes.
And sometimes we work in conjunction with the doctors at home.
Okay. And doctors at home, are they open to the kinds of therapies you do?
Some of them, after viewing, after checking the kind of responses that we're having with the patient, the good response, they are willing to continue to collaborate with us. There's some that are totally against what we do, so
Yes,
they don't, but there's everything, you know.
sure.
On our part, our main issue is a patient and we want them to get better. And so we work with whatever, you know, the patient want us to work with. Well, we do the effort to contact whatever they tell us to contact. If they want us to contact their doctor over there, we do it with no problem.
How many people can you treat in your facility at the same time? I mean,
yeah. Well, as you know, this is a new facility. It's a dream for us being here. We used to be in another building, but we built our own hospital now. We've been here for almost a year now in this new beautiful facility, state of the art. And here we are able to take care of around 35 patients. Normally we get, that will be when we're very full, but we normally have between 20 and 25 patients at a time. We do have a full hospital with hospital beds where inpatients stay. You know, we have a program that it's outpatient and we have a program that it's inpatient.
okay.
Where they can stay here. And we do have a surgery suite where we perform surgeries when needed, you know, to remove tumors if needed.
Oh, really?
To
okay.
put the central lines that we use for the intravenous solutions and for different things. Sometimes patients have like pleural effusions where we need to remove fluid from the lungs, or there's many things that we need to do. So what I'm trying to say is that we're very complete. We're gonna get our CT scanner here to be able to check everything. We have our radiology area. We have our physical therapy area. So we're very complete. We are our own laboratory here, our own dental area, you know, dental cancer is important.
So let's say somebody goes to your website and they think, oh, this sounds interesting, and maybe I'll check it out. How does the process get started? Who do they talk to? And then how does that work?
Our website, immunitytherapycenter.com, you go there and there's a form that you fill, and immediately one of our patient advocates will be in contact with the patient, or they can call us directly. We'll get the call and we'll talk to you. The patient advocate will guide you, you know, through the process.
So it's not so it's not a difficult process. There's someone taking you every step of the way.
Yeah, but normally we want to talk with the patient before they come in.
Sure.
So we evaluate and if we are a good option for them, and if we can help them, because unfortunately, like I mentioned, many times we need to tell the patients not to come because they are in a very late stage.
Sure.
But yeah, we need to do a medical evaluation first. That's part of the process, but all the intake process, you'll be guided, or the patient will be guided.
Awesome. So we have only a couple of minutes. What message do you have for people who, you know, have been diagnosed or even living a preventive lifestyle? What is it you would like to say to people about their well-being?
Well, it's good that they are following a good, you know, lifestyle. But if they end up being diagnosed with a cancer or something like that, to give them the chance, you know, for them to come and see what we can do. You know, we're very professional. We have the stigma of us being in Mexico, of not providing medical care, or you coming to a not secure place. Tijuana is like any other big city, you know, it's has good areas and bad areas, and it's very safe. Definitely I will advise them to get to know all the options before jumping into conventional treatments, because sometimes those are worse than the disease itself.
Yeah. Do you address, and we only have like one or 2 minutes left, do you address diet?
Yes, diet is very important for us. Here, we have a nutritional department that gives evaluation to the patients, and we follow a low sugar diet. That's the main thing in cancer. You know, cancer feeds on sugar, so you want to make sure that you have a low glycemic index diet. For specifics, that general for specifics, patients are evaluated here by our nutritional department, where they're given the proper diet based on that concept.
All right, so we're at the end of our time, but I really appreciate, first of all, what you're doing, because I think it's really important for us to embrace alternative therapies and to know that we have options and to explore them.
They work, you know.
Yes.
I can tell you that.
So thank you very much for being my guest. I invite people
Natasha.
who are, you know, exploring, who have issues, to check out your website and to kind of open their minds to all the other possibilities. I noticed about 35 different alternatives that you posted on your website, so that there's a lot out there.
Yes, there's a lot, and there's many more. Yeah.
So thank you, Dr. Bautista.
Thank you for having me, Natasha. Thanks a
You're
lot.
welcome. My name is Natasha Sherman. Thank you for joining us.